Welcome to our next episode of the Provider Engagement Podcast. I'm Will Dukes, the Director of Marketing here at iCare Intelligence, and we have with us our CEO, John Suarez. And today, our guest is a man that is well known amongst CMS quality circles for the last decade. He has been working in health plans around Medicare, Medicaid, Stars, quality measures, and has recently made the shift into the private sector or into the vendor side of the aisle. They're working with supplemental benefits and being able to help health plans and members to improve their overall quality, the perception of the experience that they're getting, and ultimately, right side of us working in provider engagement we're all working towards the triple aim of being able to improve quality, decrease costs, and improve the outcomes for everyone that are involved. And so, Dan Weaver, thank you very much for being here with us today. And why don't you tell everybody immediately about your latest adventures in creating internal films and everything, because you are kind of coming off set today. And people that have seen you on stage at some of these conferences that we were first met at are probably wondering where this mustache is coming from.
Yeah, I think we have to address the elephant in the room because this definitely does get a little bit of attention, Will. No, interesting enough, one of the things I've done over the last decade in the healthcare space has been to develop employee education awareness to really help bring stars and those impactful quality elements to the forefront of what we do and help employees connect the dots between what they do on a day-to-day basis and how that results ultimately in outcomes for the beneficiaries that they serve. So as you mentioned, I recently made the transition over to a company called Nations Benefits that focuses on supplemental benefits. And, one of the key parts of my role there was to really help bring the star rating equation into the fold and help ingrain that into the DNA of what we do every day. And we're taking a fun approach here. We are taking a Saturday Night Live style video series approach to, teach folks about stars, about Medicare, and all the different elements of the program and how it all works together. And yes, I am playing a ridiculous character. He just happens to have a 1970s mustache that is not trying to, give you any competition there, Will. Don't worry. Hopefully
Mine's
after
an
Wednesday,
1870s mustache, so completely different.
Exactly, different era. But give me a week and this will be gone.
Let's get into kind of that transition, like you said, you moving over to do that. I think for some other folks that know you and have been aware of all the work that you do, and even some folks that maybe aren't, would be kind of interested in understanding that transition from working inside a health plan where you're kind of directly dealing with CMS and working on those stars measures and stars ratings, and just the quality of patient care, but now saying, all right, here's a company that's not a primary care provider. It's a supplemental benefits company. They're doing some other things externally just to be able to help more efficiently and effectively close some of those gaps. How is that transition helping? And or how did that transition happen for you? But maybe the broader question there is, how are these supplemental benefits helping to improve quality overall and patient care?
Okay, there's a lot of great questions in that question. So first and foremost, how did it happen for me? One of the things I prided myself in my role over the last decade has really been trying to stay at the forefront of what was coming out of CMS and government programs, helping understand the landscape where it was shifting and what was going to happen next. And I've seen over the last couple of years that move toward a focus on member experience within the measure sets. And I come from an operational background before I get into healthcare, and I've spent a lot of time, with things like understanding analytics, advanced analytics, doing, incentive modeling and predictive modeling, and a variety of things that just, caused a little frustration as I've seen this shift toward member experience. And in the places that I was at, felt like it was becoming more and more difficult to move the needle in the direction that I wanted to go, because you've got to help educate people and truly help them understand what that really means, what those impacts look like. And I just got to a place after about a decade of doing it of, churning out 4+ star ratings at health plans and always fighting that uphill battle, where I felt like it was time to try and impact more than just one little regional plan. Yeah, I was focused in one state predominantly, and I had a lot of great opportunities to work with a lot of great people. But as I became more and more aware of what a company like Nations Benefits was doing, I saw an opportunity to really help um, explain that to more people and to make more of an impact across a lot more folks' lives. So you ask, how do supplemental benefits help improve patient care, basically? And that is a really interesting question. So, traditionally, up until a couple of years ago, supplemental benefits were your big three, right? You had hearing, vision, and dental. And every
Yeah.
once in a while, you get some OTC in there. And then slowly over the last couple of years, we saw transportation, some other things starting to creep in. But for the most part, those things were more and more focused on, smaller populations and really isolated instances. So as CMS has evolved that equation and allowed for, the value-based incentive plan designs, as they've created the SSBCI, the special supplemental benefits for the chronically ill, they've created a lot of really unique opportunities where health plans can truly bring some really innovative, very targeted solutions to their population base in ways that are going to be more meaningful. We think you hear about social determinants of health. It's been a huge buzzword for the last couple of years, but COVID was this fantastic catalyst that for all the negative things that it did and all the impacts it's had on our economy and people's lives and everything else. It's been a fantastic catalyst
Yeah.
for things that in the healthcare space we're just tracking 10, 15 years behind other industries. And we saw an overnight evolution into more receptivity toward telemedicine and other unique solutions that folks had never been willing to really embrace, and people didn't know how to model and they didn't know how to fold them into what they were doing. And now we've gotten to a place where some of these things are starting to become second nature. But we really saw SDOH barriers exacerbated during COVID. People that had food insecurities, who had issues getting to the doctor in the first place, who had, all kinds of transportation issues. As we started to see, stores shutting down and people having to order food and wait days and weeks to get deliveries, as public transportation was shut off, and some of the other transportation solutions became harder to engage with. You're seeing it now with gas prices
Yeah.
flying through the roof too. By the way, I landed here in Pittsburgh for a weekend with family, and I couldn't get an Uber or a Lyft at my airport. There literally were none available. It was the strangest thing. I've never seen that. So
Wow.
these things make an impact. And I see supplemental benefits as ways to solution for those. Every plan has so many dollars set aside to really try to bring benefits forward to their members that are going to be meaningful. The creativity that CMS is giving health plans is creating ways for them to bring solutions forward that are going to be most meaningful to their population with the problems that they are dealing with.
South Florida is one of the ground zeros for risk, and it's been for quite some time. Call it risk versus value-based care. And interestingly, the home model start bringing all those benefits into place, like Dan was mentioning, including even meals, gym memberships, and all these extra benefits in order to make sure that the patient will stay healthy. At the end of the day, the patient stay healthy. I believe everybody wins on the equation. So that's very important. The challenge, and that's one of the questions that I have for Dan, is this connection between these benefits or these benefits offered by health plans and how it reach physicians, so specifically primary care physicians, and how do you see that part of the education? I see that right now is a lot of issues with the education. How can I tailor education to these primary care providers in relation to not only supplemental benefits, but also, as your experience had it with the star measures or quality measures. So how do you see that?
That's a great question. I mean, I think at its core, there's always going to need to be stronger communication between health plans, the providers that they're partnering with, and then the solutions like supplemental benefit companies. I mean, a great example of that, the health plan designs the benefit. So if
Right.
what they're doing is telling a member that, hey, if you have a hospital discharge, we're going to give you, 2 weeks of, prepared meals. Or if you, have a population health management strategy that is going to tailor meals to, somebody with a chronic condition like diabetes or something, and you're going to offer them, 28 weeks of home tailored meals that are based on their condition. If the provider doesn't know that the member has access to that, then they're certainly not going to be asking them about those things whenever they're, in the midst of an encounter. They're not going to be encouraging the member to make smart choices with those. They're certainly not going to sit down with them to look at what options are available to them and help them pick something that's going to be meaningful. They're not going to know to coordinate with, a care manager at the health plan to get notes on, hey, what has the member ordered? How are they doing with the diet that's been prescribed, things like that. So we definitely have to encourage health plans to engage with the providers and share that information, help by providing whether it's educational insights or other things. There's another interesting angle that kind of goes back to the first question that you had asked me, Will, and I think helps with this question as well, which is it's what benefits specifically are the health plans taking advantage of? One of the more interesting ones that's really just emerged in the last year or 2 years is really flexible spending. So, we offer a flexible spending benefit. But at the end of the day, that's a financial mechanism that is making meaningful assistance available to members to use as they need.
Right.
Now, if a provider knows that that is on the table whenever they're working with a member, then they can certainly help them solve for individual needs much more effectively than if they don't. If someone's in for dental care and their dental care caps out at a certain point, but they just happen to have, a couple $100 worth of flexible spending dollars, that's fantastic. Or if a person has a couple $100 a quarter of flexible spending dollars, but doesn't have a prescribed meal benefit, and the member or the doctor knows that this person is in a situation where for the next couple of weeks, I need them to do something specific and I need them to eat very intelligently, etc. Then knowing that that type of a benefit is on the table is going to help that provider have the right conversation with the member and help educate them on how best to use those benefits. So, in my mind, it's really how do we foster communication? Because I feel like communication has been the most glaring gap in the industry between providers, health plans, and the outsourced solutions that health plans utilize to try and bridge some of the gaps.
Like right now in some of our for some of our care gap reporting, providers can log in, and if they see open care gaps, they can dig into the claims data, or they can dig into some of the other supplemental data that was provided to know where that gap was open, because they're like, I didn't open that. Where did it come from? Well, now they can see that came from some ambulatory clinic or something else like that. But if there's not this focused effort to tie all those things in, then how are they going to know? And I think there's missed benefits there, but there could also be potential risks of that too, right? Like when you just in terms of the meals and things like that. Like you would hope that somebody that was diabetic or was maybe on a wound care type of a diet, they are going to be making those right choices, and there's going to be care coordination from the health plan. But uh, I can certainly see, and I kind of speak because my wife is a dietitian, and I hear these kind of stories that come up as well. But a lot of those things you really do need to be coordinated with the PCP as well as the patient.
Yeah, I would 100% agree. And I mean, it's an interesting position to be in, where we're at, because one of the things I loved about Nations, one of the reasons that drew me there was the fact that, they are consolidating that experience both for the health plan partners that we work with as well as the beneficiaries that we serve. Many of the plans that purchase solutions from us don't buy just one supplemental benefit. We're out offering 4, 5, 6, 7 benefits in some cases because it creates a streamlined place for members to go to take advantage of the benefits that are made available to them. For the health plan, it's one singular administrative solution. You minimizing data that's flowing out of your company and everything else. So that puts a lot, if you will, of responsibility and opportunity on the plate of a company like Nations. So I definitely feel like as plans move in some of those directions with certain strategic benefits, whether they're working with Nations or not, there's an opportunity for that health plan to look at those partners, as an extension of their plan.
Right.
We provide service 24/7, 365. If a member is calling us to place an order, to use a benefit, whatever it happens to be, you're answering the phone in most cases as that health plan. So when you think about the member experience measures, when you think about all those, things that are so impactful to star ratings and the just general landscape that's out there right now within quality, these companies have a massive opportunity to create impact. One really unique program that I'm piloting right now with some health plan partners, specifically to address this pain point, because I'm intimately aware of it from being on the health plan side and having that frustration of how do I communicate better with my docs. Is we have insights. As members utilize these benefits, as beneficiaries are, you navigating this landscape that health plans have created about what they can and can't get, as a part of that benefit design. We have insights into, things that could be going on, preliminary indications of condition concerns and things like that. So, we're working with some health plan partners to actually proactively message out and communicate with providers when we have insights that could raise a concern around specific care measures. So, so much of healthcare is reactive instead of,
Right.
proactive. How do we find ways that the second that we get a piece of information that could be meaningful, that could impact the course of someone's care, how do we create an opportunity to communicate that information proactively and make sure that, we get ahead of it? That's a place where I think that more plans, more solutions need to find solutions for, because at the end of the day, like we've both said, communication is critical to, long-term success for patients.
And
And
can you just give
certainly,
us an example of like what one of those indicators might be, or something that you're all coming across, your caregivers when they're out visiting patients or delivering those benefits that
sure.
would be useful?
Yeah, I mean, I can think of a couple conditions that are pain points for health plans. So let's use those as examples because I know that I hear them brought up at conferences a lot. I hear them brought up in population health and care management circles a lot. Um, let's pick on two HOS measures. You got risks of falls and you've got incontinence. So risk of falls, most health plans aren't going to have an indication that a member has a problem unless they end up in the hospital with, a
Right.
fall, or they had to call for fall assist, or they have a fracture of some kind, or something's gone wrong. Some health plans are proactive and they do have some good survey capabilities, or they encourage members to call them and let them know if they're having concerns. But your average beneficiary doesn't necessarily think, oh, wow, I was a little lightheaded there a second ago. I should be worried about that. Or, man, that carpet's
And
torn up and I've been meaning to replace that for 25 years. I should call my health plan and talk to them about
right. And
that.
it's not even that they don't even notice that. It's like, is the first person they think of calling their health plan about it.
Exactly. But if they have a over-the-counter benefit or flexible spending dollars, and all of a sudden they start buying balance equipment for their homes, anti-slip, pieces, attachments for their, showers and tubs. If they buy a cane, but they haven't been in the hospital for a fall or anything like that, that would suggest that they need it for some reason. Like, you have insights as a solution partner with a health plan that hopefully you're going to get that insight before somebody ends up in a situation that's generating a claim. Same thing could be said for incontinence, right? I mean, if you see members starting to purchase adult diapers, certain creams, certain wipes, whatever, those could be flags. If you have good engagement models, if you have a member calling you up to ask you, can I buy this with my benefit? Um, I'm not saying that everybody's going to build that program, that everybody has the service centers to do that. But those would be easy examples to pick on because those are two pain point measures that plans struggle to figure out how best to impact. And as a provider of solutions for the benefits, if you gain that insight, how can you help communicate that? Hey, doc, Dan Weaver, next time he pops into your office, can you make sure you talk to him about incontinence? Because, we have a suspicion that he may need to talk to you.
Where do you see these working, and what do you think there is some challenges that technology companies can take advantage of?
That's also an interesting question because, those house programs really typically target a small subset of your population, right? You're looking at the folks who are going to have the highest costs or have the greatest pool of comorbidities and are most likely to be a problem. So, you have resources in those scenarios that, engage with folks. They may be able to see things that other folks aren't going to see because they're in a home, whatever. The technology solutions that partner with them, the folks that have, monitoring analytics, think of like your, personal emergency response services, you have home monitoring solutions and remote monitoring solutions. Technology is a fascinating, just wealth of opportunity. And most of the problems are figuring out how to take advantage of it, right? What to do with it. Because most of the time, most people come up with this great business case and they think, oh, we're going to use this technology and go solve this problem. And then you get tunnel vision because that's the problem you think you need to solve. And that's the problem you're building to solve. And you've designed your company to solve that. And then some random outsider comes along that doesn't know anything about your business and says, wow, if I had that, I could do these 3 things or these 4 things. Had you ever thought about doing X? And the general response is, no, 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 we're this kind of company. We do this. So I'd say the biggest opportunity with any tech company there is being able to look outside of their own design and see what are the other possible scenarios here. Because it's that type of agile flexibility that works best in our constantly evolving climate. Every day something new is happening, something's changing.
Looking from the perspective of large practices, ACOs, and the new models that go beyond the health plan, Dan, I'm not sure if Dan or Will can mention something related to large practices or ACOs. What are the role of benefits when it comes to those type of entities?
Traditionally the providers only are in a position to offer benefit solutions to really selective cohorts of members. And a lot of times it's, especially if you're in those risk-based models, where it benefits them to reduce the cost because there's a return on the back end. They can get into some of these creative clinical solutions. But the problem is that they have to be really cost effective. The data that supports them has to be really tight because you don't have the flexibility to waste. You know what I mean? You don't have the flexibility to offer something that's, targeted toward 80% of the population. You got to target that 10 or that 20% of the population that are going to make the biggest impacts. So I see things like a food benefit as one of the more interesting solutions in a scenario like that. But I could also see things like, a very short-term, flexible spending solution, things like that being a really interesting benefit to be offered by a provider base. Because one of the biggest challenges that you have with someone who is coming out of a hospitalization or even a surgery of some kind, people have scheduled surgeries that don't really end up in a hospitalization anymore, but if you know that somebody's going to be dealing with wound care, if you know that somebody's going to be in a situation where it's going to be very difficult for them to provide, prepare their own meals or cook for their spouse, even, there's certain exacerbations of situations. I am seeing some care facilities pilot some really innovative programs to offer a short-term meal solution or some type of care package or some type of really unique opportunity that is very specifically targeted to the situation that they're in. And those can work really well. Up here in Pennsylvania, I think one of the most interesting studies was Geisinger, published their pilot program about their, food prescription program. I can't remember exactly what they called it, but, the impact that they had seen by providing healthy food solutions to people with some chronic conditions has been widely scrutinized by all the people that want to do a really creative food benefit, but are looking for just mountains of data to support it so that they don't give their actuaries heart attacks.
I'd love to get your perspective on the things that providers, whether they're independents, part of a big IPA, MSO, employed, wherever, what are some of the key things that they should be looking for to increase their quality, and as star measures come out, if they're going to be involved in this value-based care, things that they have to do?
I'd say one of the biggest things that I think is an opportunity for providers is to look for the opportunities to truly understand what solutions have been made available to the beneficiaries. So I know every health plan publishes a crazy beneficiary, grid matrix. There's so much information coming out, like you'd mentioned, they get bombarded with care gap details and all these other reports, and sometimes it's an Excel spreadsheet, whatever. But the problem is that every member that walks through the door at a provider's office is coming from a different health plan and or a different line of business within that health plan. And within any line of business, there's so many variations on what a benefit structure looks like. It's very difficult, obviously, for them to stay on top of what solutions a member has. But I think a key way to really help partner with beneficiaries to make the most impact is to find that way to help fold the beneficiary into understanding benefits. So, we prep beneficiaries to bring your list of drugs or bring your bag of prescriptions with you to the doctor's office so we can review them together. We put people on the phone with them to go over, parts of their health or their health, health history, their prescriptions. Again, it's one you see a lot. How do we fold understanding that member's available benefit matrix into those encounters as well? Because if a provider knows what tools that beneficiary has at their disposal, whether that's unique benefits the plan has offered, whether it's the way that their benefit structures, work in terms of how they can access them, how frequently something may be loaded or reloaded. You think some plans, I think of over the counter because it's been around for a while. Some plans do monthly allowances. Some plans do quarterly allowances. Some plans do annual allowances. Some folks have rollover from one month to the next, while other ones don't. If you don't use it, it goes away. How do we help get the providers in the know, so to speak? And how do we put some of that onus on providers to know that they need to be asking those questions? How do they learn that I need to ask about this person's supplemental benefit design? I need to ask about what kind of extra funding they get. If that member has an incentive program, they should be asking, how can I help that beneficiary earn those incentives? And how then do I educate them on the best way to use those incentives so it's going to impact their health instead of just throwing money out there as an example? So I think that's a great way to do it. Not that docs need one more thing to do, because I know they're overwhelmed, but if there's a way to fold that into the preparation, the pre-patient visits, things like that. If it's a good, strong partnership, especially in the Medicare space, because that's where you see so much of this. If there's a way to partner with the health plan to get that information communicated, even if it's once a year, just so that they've got a chart of that stuff sitting in their office, and they're like, oh, I know Jane has, plan ABC's, benefit B. So I'm going to have my grid handy. And when, Dan Weaver pops into the office, I'm going to see, oh, wait a minute, Dan gets an over-the-counter allowance and he gets so many dollars every quarter. And, well, he can use that for all these fantastic things. Well, I know Dan just had surgery 2 weeks ago. Boy, he could probably use help with ABC. How do we fold that in? It comes back to, the more you know, the more you can do, so to speak. So how do we help providers take a little of the onus of finding that information out and pushing the health plans to share it? And then obviously, how do we work with our health plan partners to make sure that we're encouraging them to share that, which could even go so far as to preparing the materials for them to say, if you give this to the doctor, it's going to help the doctor take better care of this member whenever they come in the door.
So how do you see that education being delivered? What would be the best advice for health plans? Now you were in that aspect, you in the other side. What would be the best piece of advice that you can give these large health plans or even large groups that need to deliver or communicate these gaps to providers?
I love that question because, believe it or not, I actually started off as an English teacher. That's what I went to school for. So
That's
education is a passion of mine. I think the short answer is, unfortunately, there's no silver bullet. So the most important thing for our health plan partners to understand is that there is no one perfect way to do this. I say that because adults learn differently. Everybody learns differently. So Dr. A versus Dr. B versus Dr. C is going to have a different way of engaging and prefer a different method. You have to be willing to, the same way we do with members, where we keep talking about an omni-channel approach. You know, some people like text, some people like a phone call, some people still open their mail, some people want an email. They just want to be able to go out to a portal and pull it when they want it versus somebody pushing it to them. We need to create those same opportunities for providers. If you have things like the webinars and the town halls and the, you know, online training sessions with them, some folks will take advantage of that. Most health plans use something along the lines of a clinical transformation consultant or some type of provider liaison, and they'll set up monthly or quarterly or whatever it is sessions where they'll let people come in and share educational updates and, you know, give information. You know, we send providers things in writing. We create provider portals to make information accessible to them. Um, I think you need to rally sort of around, for lack of a better term, a theme to make sure that you are consistent in your messaging, make sure that that message that's being delivered across multiple channels is the same. But as long as you can create those varying types of delivery mechanisms for that information, you'll be able to engage with the majority of the provider base because you're meeting them on their terms. You know, some folks are going to send their front
Mhm.
office staff and they're going to ask them to go assimilate the data, bring it back, and educate the practice. Other docs are going to be highly engaged and they're going to want to be the ones at the table, hearing it directly from the health plan's mouth, reading it directly from the educational piece, etc. You need to, unfortunately, just be able to cater to all of those types of educational preferences and really build a robust process to disseminate information.
I'll leave it open to you. Any other kind of big aha or insight that you just want to make sure all of our listeners, if you had to sum it up, what would it be? What would be the big takeaway you want them to get from this?
Boy. All right. So if I could put it into one little thing, I'd say it's that at the end of the day, the only way that everybody can be successful is that if we all approach this as a partnership and that everybody is willing to, you know, open the kimono a little bit and let everybody have a peek inside. I say that because, you know, obviously health plans struggle to understand, you know, what they can share and where they can share. Providers struggle because they, you know, often express concern that it feels like they're being told what to do and how to do their jobs. And you've got third party solutions like, you know, the vendors that are out there that know that they've got something that could be really meaningful, really great, but they're just perceived as somebody that's trying to make a buck. At the end of the day, you're absolutely right. Everybody that's in this business that's doing this job is doing it because at the end of the day, they're trying to make an impact and they believe in that part of the business that they're involved in. So, across the board, if everybody is willing to come to the table as partners and say, how can we make this the best possible thing? How can we optimize this for the beneficiaries that we're serving? You'll find a lot of creativity and a lot of innovation can come out of that, and we can find really unique solutions that are going to make the types of impacts that we're looking for.
Well, I hope that everybody that is listening here can take some of these insights that we've had, and you can certainly reach out to myself or John or Dan with any follow-up questions, and so we can all continue moving on that path towards a better healthcare system here and tomorrow. So be well, and we'll see you in the next installment.